Good afternoon once again. Today is Sunday, the 11th of July, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA, as always. So first of all, we had the Thai language briefing by Dr. Tui Sin. We also had, prior to my briefing, the Chief of Defense Forces of the Royal Thai Armed Forces, General Chalermpol Srisawat, who gave a briefing regarding the enforcement measures, which I will summarize for you in a moment. But firstly, just to start off first with the general situation that we have recorded for today. New confirmed case we have recorded for today at 9,539, which is actually a new high. You can see that in the chart on screen right now in the blue box on the left. New recoveries, trailing behind, we have 4,053 new recoveries. We have 85,689 active cases still being treated currently, out of which 2,783 are in critical condition, and out of that number, 728 are on ventilators. The reason that we give these numbers is because you can have the information on the severity of the patients that are currently being treated at the moment. Now, the numbers of those in critical condition and on ventilators, they fluctuate every day, but more or less around these numbers in the past few days. Critical condition being around 2,000 plus, and ventilators in the hundreds. New fatalities, unfortunately, we have to report 86 new fatalities recorded for today, with the median age at 65, making the cumulative total of fatalities, as you see on screen on the red box on the right. Now, for the overall situation, we have the area with the highest number of new cases remaining in Bangkok at 2,741 new cases only in Bangkok. And you see that list on screen for you. Still remaining with the provinces in the central region, as well as some in the southern region of Thailand. Overall, 1/3 of the cases are found in Bangkok, and 1/3 in the 5 provinces adjacent to Bangkok, and the rest are in other provinces. Just a piece of information regarding the public transportation services. As you have already learned by now, the new measures announced since on Friday and announced officially in the Royal Gazette on Saturday, yesterday. This, of course, affects public transportation, wherein on Monday, the Bangkok Mass Transit Authority will adjust operation services from 5 a.m. to 9 p.m. to comply with the nighttime curfew, which starts at 9 p.m. for the dark red zone. This schedule applied from the 12th to the 25th of July 2021. And the BTS, MRT, and airport rail link all will cease their services at 9 p.m. And bus services from Bangkok to southern provinces will also be suspended. The bus services and routes to the northern and northeastern regions are also reduced. Some airlines have also announced that their domestic services will be temporarily cut or suspended. So anyone planning for intra-provincial travel, carefully check your schedule. However, as we have announced, intra-provincial travel is discouraged at this time. On antigen rapid test, yesterday the Department of Health Service Support announced that private hospitals are now able to use antigen rapid tests to determine possible infections. Now, this is a new announcement just recently, and this antigen test will accelerate the testing process to cope with the high demand from the public. Moreover, on Monday, the Health Ministry will discuss about the selling of the rapid antigen tests, these kits, to the public. These self-test devices, kits, to be sold by pharmacists will enclose recommendations and guidance on the positive result. So this is good news. If a person is tested positive from these tests, they will be retested by RT-PCR process and be diagnosed by a doctor to determine whether they are at the high-risk group. Those in the high-risk groups will be admitted to hospital, while those with mild or no symptoms will be advised to observe home isolation if possible. So this is a very positive update that we have regarding the testing for COVID, which soon will be available in terms of self-test and kits available for purchase in pharmacies. From the home isolation guideline, patients under the scheme of home isolation must be able to be confined in their own room, have access to separate bathrooms and separate set of utensils. The patients will be provided with a thermometer, a fingertip pulse oximetry, and 3 meals per day. They will also be diagnosed through telemedicine services daily. I'd like to move on to the enforcement of disease control measures. As mentioned earlier, before I took the podium, General Chalermpol Srisawat, the Chief of Defense Forces of the Royal Thai Armed Forces, gave a briefing on the enforcement of the new restrictions, especially on interprovincial travel and border control. The security forces, consisting of soldiers, police, and local administrative officials, were already deployed since early Saturday morning to security checkpoints, especially in the dark red zone provinces. And we'll have these images coming up for you. These images are very recent, just yesterday or last night. Now, these stricter measures will be applied to the 10 provinces, especially because of the curfew at 2100 to 0400 hours, or 9 p.m. to 4 a.m. And in addition, they'll be having joint surveillance teams as well to check on the enforcement, implementation of all these measures in the area involved. The Chief of the Armed Forces has ordered 88 checkpoints to be set up in Bangkok, a total of 88 checkpoints in Bangkok. And another 20 checkpoints were put up in surrounding provinces of Bangkok. In addition, for the 4 southern border provinces, 39 of these checkpoints have already been set up. Now, he mentioned about the illegal border crossing, illegal entry into Thailand, which is still rampant, which is still happening, despite all the enforcement measures that we have. Of course, we have a porous border, a long border with our neighboring countries. Many are natural pathways of forests, hills, and mountains. So it has been quite difficult to stem the illegal entry. That has been still going on despite all of our efforts. So therefore, there will be very strict measures put in place, especially along the border areas. This includes the placement of more personnel, as well as more equipment, as well as stronger collaboration with villages in the border areas, and local administration officers. This is, of course, to stop all of the activities that are causing damage to our country. And this is very important. The Chief of the Defense Forces of the Royal Thai Armed Forces came to deliver this commitment himself just now. On the new active case finding center by the Social Security Office, I'll just touch a little bit on this, that from tomorrow, the 12th of July, the Labor Ministry is setting up the new COVID-19 active case finding center for the general public and workers at the Thai-Japanese Stadium, Dindang, Bangkok. People who wish to take the test can make an online registration, and you have details of that on screen. After testing, the result will be informed through a QR code. Yes, so you can find information through the registration and that website. So basically, this is just a brief summary that I have for you today, Sunday. I don't want to go for too long on a weekend. As mentioned, we will have the daily press briefing from now on Monday, Wednesdays, and Fridays. And before closing, just to remind you that the new restrictions, including the curfew, the closure of certain premises, will become effective tomorrow. So meaning tomorrow night. You cannot leave your premises at 9 p.m. onwards if you are in the dark red zone, or the 10 provinces, including Bangkok. And the CCSA would like to thank all of you, Thai nationals as well as foreign nationals, our friends here, for your cooperation and for your understanding with all these measures that we have put in place. And we wish everybody to stay safe during this difficult time ahead. Hopefully that this difficult time will not be very long. With that, I thank you for your attention and have a great rest of the weekend. สวัสดีครับ
ครับขอบพระคุณนะครับ